The widowed millionaire's autistic twin daughters wouldn't sleep until the poor cleaner did. For months, no doctor, medicine, or specialist could ease the suffering of the widowed millionaire's autistic twins. It took a poor cleaner, carrying her own grief, to do something no one had ever tried. But the act that finally brought peace to the children awakened hatred, jealousy, and a devastating revenge. What this woman uncovered almost cost her freedom, and exposed the truth behind an obsessed and dangerously close colonial mansion high in the Berkshire Hills trembled with the twins' cries. It wasn't a common cry, the kind any new father learns to decipher. It was a sharp, continuous wail that pierced through walls and seeped into every crevice of the Ashford mansion in Oak Ridge. Robert Ashford, 42, a renowned architect and recent widower, paced in circles in his 6-month-old daughter's room. Under the dim light of the lamp, his face revealed a map of exhaustion. Deep-set dark circles, an unshaven beard, red eyes that no longer distinguished dream from reality. "Clara, Sophia, please," he whispered, rocking. The double crib with one hand while with the other, he squeezed the wedding band he still wore. 5 months had passed since Beatrice had been lost during a complicated childbirth, leaving him alone with 2 newborns and a mansion that now felt more like a labyrinth of guilt and memories. The phone rang for the 3rd time that morning. "Mr. Ashford, I'm sorry to insist." Dr. Eliza Monroe's voice sounded concerned on the other end of the line. "Are the girls still crying? I can be there in half an hour." "There's no need, doctor. It's almost 4 in the morning." "Robert." The informal tone did not go unnoticed. "I insist. I'm worried about you, too. Ever since since it happened, you've barely slept. This isn't healthy." Robert hesitated, watching his daughters squirming in their cribs. Clara, the older by just 2 minutes, stared fixedly at a spot on the ceiling, ignoring the colorful mobile spinning above her head. Sophia rocked rhythmically, a pendulum-like motion the pediatrician had classified as normal for infants. "All right," he finally conceded. "Mrs. Celia has the keys." He hung up the phone and sat down in the worn armchair, the one Beatrice had chosen especially for the late-night feedings that never happened. It was there in that same pale yellow room that they had dreamed of the future, a future that was now reduced to surviving until the next cry, the next bottle, the next day. Mrs. Celia Morgan adjusted her heavy-framed glasses as she opened the front door. At 68, she had worked for the Ashford family for over 2 decades. She had watched Robert grow up, get married, and now waste away with grief. "Good morning, Doctor," she greeted in her austere manner, mentally noting the time. 4:27 a.m. It would be recorded later in one of her brown-covered notebooks, along with all the events in that house she deemed worthy of note. Dr. Eliza Monroe entered with the familiarity of someone who knew every corner. Tall, with dark hair pulled back in a severe bun, she carried her inseparable thermal bag. "Are they worse today?" she asked, heading up the stairs without waiting for an answer. Celia just watched, noticing how the doctor adjusted her discreet lipstick before entering the children's room. There was something in her gaze when she mentioned Robert that the old housekeeper did not approve of. A dear, possessive gleam that didn't fit the doctor-patient relationship. Jane Miller awoke with the first ray of sunlight. Her small room at the back of the property was simple but clean, a far cry from the makeshift lodging where she had slept for the last few months, ever since leaving the hospital without her baby in her arms. She put on the grey uniform she had found folded on her bed the day before when she arrived to replace the former cleaning lady. She hadn't even had time to get to know the house or the children properly. She had only received brief instructions from Mrs. Celia and had been sent to clean the east wing of the mansion far from the main bedrooms. 24 years old, experience as a domestic worker, no family in the area. Jane mentally repeated the information she had given in the interview. The rest, the baby who hadn't made it, the partner who disappeared upon learning of the pregnancy, the nights of crying in the hospital, she kept to herself. This job was her chance to start over, to escape the memories. As she prepared breakfast according to the detailed instructions left by the housekeeper, she heard voices coming from the main hall. "Administer these drops in the morning and evening bottles. They're mild stimulants, they'll help with development." The female voice sounded professional, but there was an undertone Jane couldn't identify. "Are you sure, Eliza? They're already on so many medications." The male voice sounded exhausted, broken. "Robert, trust me. I've known these girls since they were born. I know what's best for them." Jane focused on her task, trying not to listen to the conversation that was clearly not her business. Still, something about the phrase, "I know what's best for them," sent a shiver down her spine. How many times had she heard doctors say the same thing about her own son before the end? At 10 in the morning, while cleaning the windows in the main hallway, Jane heard the twins' cries for the first time. It wasn't just any cry. It seemed to contain something primitive, desperate. Without realizing it, her steps led her closer to the sound. The bedroom door was ajar. She peeked in discreetly, seeing Robert trying, unsuccessfully, to soothe one of the babies, while the other writhed in the crib. "Can I help, sir?" The words escaped before she could. "Stop them." Robert turned, surprised. In his arms, little Clara arched her back, rejecting his touch. "You're the new staff member, right?" There was something defeated in his eyes. "I don't think anyone can help them. Not even the medication the doctor prescribed seems to be working." Jane entered the room timidly, observing the two girls. Her eyes, trained by recent suffering, noticed details, the way they avoided eye contact, their hypersensitivity to touch, the repetitive movements. "May I?" she asked, gesturing toward the baby Robert was holding. He hesitated, but desperation won out. He handed Clara over carefully. Jane didn't hold her right away. First, she let the child feel her presence, her warmth. Then, with gentle movements, she wrapped her in her arms, applying light pressure. To the surprise of both, Clara stopped crying almost instantly. "How did you—" Robert began, incredulous. "My son." Jane swallowed hard. "My son was sensitive to stimuli. Sometimes what feels like a comforting hug to us is overwhelming for them." Before Robert could ask more, Sophia began to cry harder. Jane looked at the second baby, recognizing the same pattern. "They're special, aren't they?" she asked softly, with no judgment in her voice. "Different from what doctors consider typical." Robert sank into the armchair as if crushed by an invisible weight. "Dr. Monroe says it's just a difficult phase, that it will pass with treatment. But I don't know anymore." At that moment, the door opened completely. Mrs. Celia entered with a tea tray, her piercing gaze assessing the scene. "Jane, I thought I made it clear that your duty today is to clean the East Wing." "I'm sorry, Mrs. Celia. I heard the crying and—" "She helped," Robert intervened, watching Clara asleep in the new employee's arms. "It's the first time in days Clara has calmed down so quickly." The housekeeper adjusted her glasses, a habit when she was displeased. "Dr. Monroe's instructions are not to interfere with the children's routine. She will be here again this afternoon for the weekly appointment." Jane reluctantly returned Clara to the crib. The baby stirred for a moment but did not wake. "Excuse me," she said, leaving the room. But as she returned to her tasks, something inside her had shifted. Those children had touched her in a way she hadn't felt since the loss of her own son. And in those small, anguished faces she saw more than discomfort. She saw silent pleas for help. What Jane didn't notice as she left was Mrs. Celia's calculating gaze following her down the hall. Nor did she see the housekeeper pull a small notebook from her apron pocket and jot something down in her meticulous handwriting. 10:32 a.m. New employee intervenes with the twins. Unexpected result. Observe closely. 3 weeks had passed since Jane's arrival at the Ashford mansion. The Oak Ridge mornings, with their characteristic mist enveloping the contours of the property, followed a seemingly stable routine, yet one permeated by silent tensions. Mrs. Celia observed everything from the corners, as watchful as a sentinel. Her brown notebook now contained pages and pages of notes, precise times of Dr. Monroe's visits, the duration of the twins' crying spells, changes in medication. That morning, while organizing clothes in the hallway closet, she overheard the conversation between Robert and the doctor in the library. "The tests showed nothing abnormal, Robert." Dr. Monroe's voice was soft, almost intimate. As I've been saying, their behavior is just a difficult phase. With the right medication, we'll get through this. But it's been 6 months, Eliza. They still don't. Make eye contact. They get startled by any noise. They have meltdowns when we change their routine. You're looking for problems where there are none. Her tone hardened slightly. This obsession with labeling your daughters isn't healthy. First it was reflux, then a milk allergy. Now you want them to have some disorder? Mrs. Celia quietly approached the ajar door, seeing how the doctor placed a hand on Robert's arm, keeping it there for too long. "I'm sorry," he said, running his hands through his disheveled hair. "It's just that I'm exhausted. I haven't slept a full night since... well, you know." "Since Beatrice passed," Eliza completed, moving closer. "I understand, Robert. I was by your side at that moment, and I'm here now. You're not alone in this." The housekeeper mentally noted how the doctor mentioned the deceased wife's name with a familiarity that bordered on disrespect. She also saw the discomfort on Robert's face when she got too close. "I've increased the dose of the stabilizer," Eliza continued, opening her thermal bag and taking out 2 unlabeled vials. "This will help with the nighttime crises, and I also brought something for you to sleep better." "I don't know. Eliza, we're already giving the girls so many medication. Trust me." Her smile was confident, professional. "I know your family history better than anyone. I took care of your mother until the end, remember? I know what I'm doing." Outside the mansion, Jane was taking her 15-minute break to breathe the fresh mountain air. Leaning against a century-old tree, she watched the activity through the library window. Even from a distance, she could see the body language between her employer and the doctor. The past few weeks had been revealing. The young domestic worker, though discreet, had developed a keen eye for the patterns of the house, especially those related to the twins. She had noticed how the crises worsened approximately 1 hour after each dose of the medications brought by Dr. Monroe. She had also observed how the little ones responded differently to stimuli. Bright lights caused extreme discomfort. Certain fabrics caused irritation on their delicate skin. High-pitched sounds triggered intense crying. "It's not a phase," she murmured to herself, remembering her own son who, even in his brief time, had shown similar sensitivities. A movement at the property's entrance caught her attention. Dr. Monroe was leaving in a hurry, not noticing Jane's presence under the tree. For a moment, the doctor stopped near her car and opened the thermal bag. With a furtive glance around, she quickly transferred a few vials from an inner compartment to her handbag, then closed everything up. The gesture was brief, but revealing in its secrecy. Jane quickly went back inside, her break over. In the hallway, she almost collided with Mrs. Celia. "Pardon me, ma'am," she said, regaining her balance. The housekeeper adjusted her glasses, studying her. "The girls are crying again," she informed with her usual neutral tone. "Mr. Ashford is trying to calm them, but—" Jane nodded, understanding the unspoken request. In recent weeks, despite the initial instructions, her ability to soothe the twins had become a valuable resource in the house. Even Mrs. Celia, with all her rigidity, acknowledged that the young woman's presence made a difference. "I can see if he needs help," Jane offered. "Dr. Monroe does not approve of interventions outside of her protocol," the housekeeper warned. Then, lowering her voice, "But she's no longer here, is she?" It was the first time Jane saw something like complicity in the elderly woman's eyes. In the twins' room, Robert was pacing back and forth, carrying Sophia while Clara thrashed in her crib. His face showed the internal struggle between following medical advice and his paternal instinct, which screamed that something was wrong. "Mr. Ashford," Jane knocked lightly on the door. "Mrs. Celia informed me that the girls are agitated." "Jane." He almost whispered her name, as if it were a cry for help. "They're worse today. Dr. Monroe just increased the medication, but—" The young woman approached cautiously, observing the twins. Both of their eyes were dilated, their faces flushed. Clara was rocking frantically, while Sophia seemed lethargic, in her father's arms. "May I?" she asked, indicating Clara. Robert nodded, grateful. With slow, precise movements, Jane picked up the baby, wrapping her in a firm but gentle hug, applying constant pressure. She began to hum softly, a simple, repetitive melody. Gradually, Clara began to relax. "How do you do it?" Robert asked, amazed. "You're the only person besides me they allow to get close without having a meltdown." Jane hesitated, feeling the weight of the words she held back. "My son," she began, her voice almost breaking. "He had special sensitivities. It took me a while to understand, but I learned that he perceived the world differently, more intensely." "Your son?" Robert seemed surprised. "I didn't know you had a son." "Had," she said simply, the pain still present in the past tense verb. "He left us during childbirth. Complications." Robert looked at her with new eyes, finally seeing beyond the discreet employee. He saw the familiar pain, the shared grief. "I'm so sorry," he said with sincerity. "Beatrice, too, during the girl's birth." An understanding silence settled between them, filled only by the soft breathing of Clara, now asleep in Jane's arms. "I think your daughters are special," she said finally. "Not sick or difficult, just different. Dr. Monroe insists it's just a phase, that with the right medication they'll develop normally." "And do you believe that, sir?" The question came out more directly than she intended. Robert looked at Sophia, who was finally relaxing in his arms. "I don't know what to believe anymore. Eliza has been our rock since it happened. She was the one who saved the girls when Beatrice had the hemorrhage. She took care of my mother until her last day. She's practically family." Jane noticed the shadow that crossed his face when he mentioned the doctor as family. "Sir, forgive my intrusion, but have you considered a second opinion? Another specialist?" Robert's expression hardened. Eliza made it clear that changing the approach now would be detrimental. She said they had already visited 3 specialists during the pregnancy, and they all agreed with her, that Beatrice trusted her completely. Jane nodded, backing down. She had touched a sensitive point. "I understand. I'm sorry if I overstepped." His expression softened. "No, you're just trying to help. And you've been a great help, actually. The girls respond to you in a special way." At that moment, Clara stirred in Jane's arms, opening her eyes. To the surprise of both, the baby looked directly into the young woman's face, a rare and precious moment of eye contact that lasted a few seconds before she looked away. "Did you see that?" Robert whispered, moved. Jane nodded, feeling tears welling up. "I did. She's trying to connect, in her own way." Outside the room, invisible to both, Mrs. Celia watched the scene with interest. She pulled out her notebook and wrote, 3:47 p.m. Eye contact from Clara with Jane. First observed since I began recording. Coincidence. Occurred 3 hours after the last dose of medication, when the effect begins to wear off according to my records. The housekeeper put the notebook away and moved off silently. In her room, a shoebox contained months of meticulous observations, and a disturbing pattern was beginning to emerge, one that the experienced old woman was not yet ready to name, but which caused a growing unease in her chest. The morning mist had not yet dissipated when Dr. Monroe arrived at the mansion outside of her usual hours. The living room clock read 6:17 a.m. when Mrs. Celia, surprised by the early visit, opened the front door. "Good morning, Celia." The doctor entered without waiting for an invitation, her thermal bag held firmly in her right hand. "Is Robert awake? I need to examine the girls urgently." The housekeeper narrowed her eyes behind her heavy glasses. "Mr. Ashford finally managed to get to sleep at 4 this morning, Doctor. The little ones are also sleeping for the first time in days." "Sleeping?" Eliza stopped in the middle of the hall, her expression flickering between surprise and something harder to name. "Without medication. The last dose was administered yesterday afternoon, as per your instructions," Celia replied, carefully observing the doctor's reactions. "Around 10 o'clock last night, the new employee managed to calm them. They've been sleeping peacefully ever since." A muscle twitched in Eliza's face. "What employee?" "Jane Miller, hired almost a month ago for general services." "And since when do domestic workers interfere with the medical care of children?" The doctor's voice took on a sharp edge. Mrs. Celia adjusted her glasses, buying time. There was no medical interference, Doctor, just soothing techniques. Mr. Ashford himself requested her help. Eliza strode toward the staircase, determined. I'm going to examine the children, right now. I'll wake Robert if necessary. This interruption in their routine could have serious consequences. As you wish. The housekeeper gave a slight nod, watching as Eliza hurried up the stairs. As soon as the doctor disappeared down the upper hallway, Mrs. Celia quickly made her way to the back of the house. Jane was in the small side garden, picking herbs for the morning tea, when she sensed a presence behind her. She turned to find Mrs. Celia's serious face. The doctor arrived unannounced, the housekeeper informed her in a low voice. She's furious to learn that you calmed the girls last night. Furious, but why? The children finally managed to sleep without crying. Exactly. Mrs. Celia looked around, making sure they were alone. Come with me to my room. There's something I need to show you. Intrigued and apprehensive, Jane followed the elderly woman through the kitchen and down a service corridor until they reached a small room in the staff wing. The space was simple but impeccably organized, with a single bed, an old wardrobe, and a desk piled with carefully stacked papers. Mrs. Celia locked the door and went to the wardrobe. From a drawer, at the back, she pulled out 5 identical brown-covered notebooks along with a shoebox. I've worked for this family for 23 years, she began, sitting on the bed and indicating the desk chair for Jane. I saw Mr. Robert grow up. I saw him bring Mrs. Beatrice home to meet the family, and I was here throughout her entire pregnancy. She opened the first notebook. I have a habit of recording everything. My memory isn't what it used to be, so I write down events, times, conversations. Initially to stay organized, but over time, I noticed patterns. Jane looked at the pages covered in meticulous handwriting. Dates, times, names, medications, behaviors. Dr. Munro started treating the family when Mr. Robert's mother fell ill about 8 years ago. She quickly became indispensable. She visited daily, knew every detail of the routine, every medication. She turned a few pages, revealing older notes. His mother always got worse after the doctor's visits. Side effects, Eliza would say. Part of the process, she'd explain. The deterioration is normal, she'd justify. Jane felt a shiver run down her spine. Are you suggesting that— I'm not suggesting anything, Celia interrupted, closing the notebook. Just sharing observations. After Robert's mother passed away, Eliza remained close, very close. When he met Beatrice, the doctor became different, more controlling. She insisted on being Beatrice's personal physician during the pregnancy. She opened another notebook, this one more recent. Now observe this pattern with the twins. Jane studied the pages. Precise medication times followed by notes on the children's behavior. 4:45 p.m. Medication administered. 5:53 p.m. Clara begins to cry intensely. 6:07 p.m. Sophia exhibits muscle rigidity. Page after page, the same pattern repeated. The crises always start about an hour after the medication, Jane murmured. And end. About 4 hours later, when the effect wears off, Mrs. Celia completed. Except when you intervene. Your method seems to partially neutralize whatever is causing their discomfort. Jane's heart began to race. Do you think the doctor is— A scream from upstairs interrupted their conversation. The two women looked at each other for a second before rushing to the door. In the twins' room, Robert was facing Eliza with a mixture of confusion and anger. What are you doing? They were sleeping peacefully. The doctor had Sophia in her arms, administering drops from an unlabeled vial into the mouth of the child, who was now crying desperately. Clara in the crib next to her was already showing signs of agitation. I'm correcting the mistake, Eliza replied with professional coldness. You can't just stop the medication because someone managed to calm them for a moment. That causes chemical dependency, Robert. It can lead to seizures, developmental delays. They slept through the night without crying, for the first time in months. A coincidence, nothing more. Eliza returned Sophia to the crib, the baby already writhing and crying with greater intensity. Their systems have grown accustomed to the medication. Stopping it abruptly is irresponsible. At that moment, Jane and Mrs. Celia arrived at the door. Eliza turned immediately, her gaze hardening at the sight of the young employee. "You must be Jane." Her voice was pure ice. "The person who decided to play doctor with vulnerable patients." Robert stepped in, positioning himself between the two. "Eliza, don't be unfair. Jane just helped calm them when nothing else worked." "And with what authority?" The doctor moved closer, intimidating. "What is your training, Miss Miller? Medicine, child psychology, pediatric neurology?" Jane held her gaze despite feeling diminished. "None, doctor. Just personal experience and careful observation." "Exactly. Personal experience." Eliza practically spat the words. "Robert, would you entrust your daughter's health to someone with no professional qualifications? Based on what? Feelings?" The babies were crying louder and louder, their wails filling the room. Jane watched the internal conflict on Robert's face, the hope of something new against the security of the familiar medical authority against intuition. "Doctor," Mrs. Celia intervened with her usual calm. "Perhaps we should prioritize calming the girls right now." "That's exactly what I'm trying to do, following proven medical protocols," Eliza retorted, pulling another vial from her thermal bag. "Now, if everyone could, please leave so I can properly examine my patient." "No." The word came out of Robert's mouth with a firmness that surprised everyone, including himself. "Excuse me?" Eliza seemed genuinely shocked. "I want to see how Jane calms them, without medication. Just for today." The doctor paled. "That's absurd, irresponsible. It puts your daughters at risk." "It's just one attempt," he insisted, a glimpse of his old vigor emerging. "If it doesn't work, we'll go back to your method." Eliza looked from Robert to Jane, then to the crying children, calculating her next move. "Fine," she finally conceded, her tone now falsely conciliatory. "Let's observe Miss Miller's special technique, but be warned, any worsening of the girl's condition, any sign of regression, and you will assume full responsibility, Robert." Jane cautiously approached the cribs, aware of the doctor's critical gaze. With gentle movements, she picked up Clara first, who was crying most intensely. Instead of trying to silence her, she allowed the baby to express her discomfort, simply offering a secure presence and constant pressure. "Shh," she whispered, rocking in a slow, predictable rhythm. "I know you're confused. It's okay. I'm here." To Eliza's surprise and Robert's relief, Clara gradually began to calm down. Her screams turned into sobs, then into more regular breathing. Jane looked at Robert, who understood the signal, and picked up Sophia, mimicking the employee's movements. "Firm but gentle pressure," Jane instructed. "Predictable movement, a low, calm voice." Sophia, though still agitated, responded to her father's touch, her crying diminishing in intensity. "Incredible," Robert murmured, looking at Jane with gratitude. Eliza watched the scene with an unreadable expression. Finally, she snapped her thermal bag shut. "An interesting technique," she conceded coldly, "but insufficient in the long run. I'll be back tomorrow for a full evaluation and medication adjustment." She turned to leave but stopped at the door, looking directly at Jane. "Miss Miller, isn't it? I'd like to have a private word with you before I go." It wasn't a request. Jane handed Clara to Mrs. Celia and followed the doctor into the hallway. As soon as they were alone, Eliza dropped any pretense of cordiality. "I don't know what you think you're doing," she said in a low, threatening voice, "but those children have been my patients for months. I have a specific protocol developed for their case. I'm just trying to help, Doctor." "Help?" Eliza gave a humorless smile. "Or are you trying to replace the child you lost?" Jane recoiled as if she'd been slapped. "How did you—" "I did my research. Jane Miller, 24, premature birth at St. Monica's Hospital 6 months ago. The baby did not survive due to respiratory complications." Eliza leaned closer. "Untreated trauma, unresolved grief, emotional transference onto other children, a classic case of postpartum psychological instability." Jane felt her legs weaken, but she stood firm. "That has nothing to do with my ability to help the twins. On the contrary, it has everything to do with it." Eliza's voice was almost a whisper now. "Emotionally fragile people make mistakes, serious mistakes, and when those mistakes affect children, well, the consequences can be devastating. The threat hung in the air between them. This is a warning, Miss Miller. Stay within the limits of your role. Cleaning, laundry, cooking. Leave the medical issues to those who are qualified, for everyone's sake, especially yours. With that, Eliza walked away, descending the stairs with her usual elegant posture. Jane remained motionless in the hallway, trying to process what had just happened. From the twins' room, silence was the only sound. A precious, rare silence that Jane now knew she would have to fight to preserve. The weekend arrived with a small revolution in the Ashford mansion. For the first time in months, Robert made a decision without consulting Dr. Monroe. He suspended all of the twins' medications for 48 hours. "It's just a test," he explained to Mrs. Celia as they prepared the morning bottles without the usual vials. "I need to see how they react without the substances, just to be sure." The housekeeper nodded, adjusting her glasses with silent approval. On the other side of the kitchen, Jane worked discreetly, pretending not to hear, but her tense body revealed her attention to the conversation. "Miss Miller can help us if the girls get too agitated," Robert continued, glancing briefly at Jane. "Her techniques have been remarkable. The first day without medication was surprising. Although the twins were more sensitive to stimuli, loud sounds easily startled them, changes in light caused restlessness, the constant, desperate crying disappeared. Clara even managed to maintain eye contact with her father for a few seconds, something he hadn't seen in months. "They're different," Robert commented, amazed, as he watched Sophia explore a cushion with her small hands, fascinated by the texture. More present. Jane, who was helping him fold small clothes in the children's room, smiled discreetly. "Maybe this is who they really are, sir, without the fog of the medications." The second day confirmed their suspicions. The twins ate better, slept for longer periods, and most importantly, their expressions seemed more alert, curious. There were still challenges. Sudden noises provoked intense reactions. Certain fabrics caused extreme discomfort. The routine had to be strictly maintained. But they were manageable challenges, nothing compared to the devastating crises of the previous months. "I think we need to talk about this," Robert said to Jane, on Sunday evening, after putting the girls to bed without any meltdowns. "About what's really going on." They sat on the small back porch, the fresh mountain air wrapping around them like a cloak. Mrs. Celia joined them silently, bringing a tray with tea and her inseparable brown notebooks. "I have been observing a disturbing pattern for the last few months," the housekeeper began, opening one of the notebooks on the rustic table. "The girls' crises always worsen approximately 1 hour after the administration of Dr. Monroe's medications." Robert examined the meticulous notes, his face gradually paling. "And that's not all," Celia continued, opening another notebook. "The doses have been consistently increasing, without any documented medical explanation. When Miss Jane started to intervene, I noticed a direct correlation. At times, when she calmed the girls without medication, Dr. Monroe would increase the doses the next day." "But why?" Robert's voice failed him. "Why would Eliza do that? She's known our family for years. She took care of my mother." Jane and Celia exchanged hesitant glances. "Sir," Jane began cautiously, "have you ever considered that perhaps Dr. Monroe has feelings for you, beyond professional ones?" Robert looked genuinely surprised. "Eliza? No, that's impossible. We're just friends, colleagues. She was Beatrice's doctor, for God's sake." "And she was always present," Mrs. Celia observed, "in every moment of vulnerability. When your mother fell ill, during Mrs. Beatrice's complex pregnancy, after the sad event at the birth, and now with the twins." Something began to form on Robert's face, a slow, painful understanding. "Are you suggesting that Eliza is creating situations where you need her?" Jane concluded softly, "where she becomes indispensable?" A heavy silence settled among them, broken only by the wind in the ancient trees. "The girls got better without the medication," Robert murmured finally, "and they got worse with it. If this is true—" "We need concrete proof," Mrs. Celia interrupted pragmatically. "Assumptions are not enough for an accusation of this magnitude." Jane bit her lip, hesitant. I saw something strange last week. She told them about the moment she had caught Eliza testing the contents of the bottles, furtively swapping vials, and the labels on the medications. Many are partially torn or illegible. I'm going to confront her, Robert decided, standing up abruptly, tomorrow when she comes for the weekly appointment. No, the two women spoke in unison. If our suspicions are correct, Celia explained, confronting her directly could be dangerous. She will deny everything, destroy evidence, and possibly do something even worse to the girls to prove they need her, Jane finished. Robert ran his hands over his face, the weight of the possibility crushing him. What do you suggest, then? We need to keep observing, the housekeeper said. Gather concrete evidence, and maybe consult another specialist discreetly. The next morning, the routine was abruptly shattered by the shrill sound of the doorbell. Mrs. Celia, who was preparing breakfast, glanced at the clock. 7:32 a.m., too early for visitors. When she opened the door, she found Dr. Monroe accompanied by two men in white coats. "Good morning, Celia," the doctor said with a tense smile. "These are Dr. Marshall and Dr. Peters, pediatric neurologists. We've come to do an emergency evaluation of the twins." Emergency? The housekeeper couldn't hide her surprise. Mr. Ashford didn't mention any appointment. It was a last-minute arrangement, Eliza pushed past without an invitation. Based on my professional concern for the children's development, Robert has already been informed by text. At that moment, Robert came down the stairs, still in his pajamas, clearly surprised by the visit. "Eliza, what is this?" "Robert, darling, check your phone. I sent you a message last night explaining the need for this urgent evaluation." "I didn't get anything," he replied, confused. "Strange." She frowned with theatrical concern. "In any case, we're here now. Dr. Marshall is a specialist in childhood neurological disorders, and Dr. Peters is a pediatric psychiatrist. I'm worried about the girls' development after the abrupt discontinuation of their medication." The two doctors maintained impassive, professional expressions. They carried identical medical bags. "How did you know I stopped the medication?" Robert asked, his voice hardening. "Why, the doses I left on Friday were still untouched when I checked the bedroom cabinet yesterday afternoon, during my visit." "What visit? You weren't here yesterday?" An uncomfortable silence fell. Eliza recovered quickly. "Of course I was. Mrs. Celia can confirm I stopped by quickly to drop off some new vitamins." The housekeeper adjusted her glasses, her face unreadable. "I have no record of your visit yesterday, doctor, and I was in the house all day." Eliza shot a cold glare at the elderly woman before turning back to Robert with renewed sweetness. "You're exhausted, darling. The confusion is understandable. The important thing is that we're here to help. The twins need to resume their treatment immediately." Before Robert could answer, the cry of one of the babies was heard from upstairs. It wasn't the desperate cry of previous months, but the normal cry of a waking child. "I'll check on the girls," he said, heading up the stairs. Eliza made a move to follow him, but Robert held up a hand, stopping her. "Alone, please. I'll join you shortly." In the room, he found Jane already soothing Clara, while Sophia watched curiously from the neighboring crib. "Dr. Monroe is here with two specialists," he whispered. "She says she came by yesterday to check the medications." Jane turned pale. "Impossible. I was with the girls all day. No one entered this room besides you and Mrs. Celia." "That's what I thought." Robert picked up Sophia. "She's lying, and she doesn't even care about being consistent. What are we going to do?" "Buy time." He took a deep breath. "I'm going downstairs to try to manage the situation. Stay with the girls. Don't let anyone in without me." Back in the living room, Robert found the three doctors seated with Eliza, leading the conversation in a low voice. They fell silent when he entered. "The girls just woke up," he announced. "Jane is getting them ready. In the meantime, I'd like to better understand this surprise consultation." Dr. Marshall, a man in his 50s with graying hair, cleared his throat. "Mr. Ashford, Dr. Monroe presented us with a very concerning case. Twins with a probable neurodevelopmental disorder, medication abruptly stopped, interference from an unqualified employee. "And how long have you worked with Dr. Monroe?" Robert interrupted. The doctors exchanged quick glances. "We've been colleagues for many years," Dr. Peters replied vaguely. "Interesting. Could you show me your credentials, please? Medical license, specialization?" Eliza interjected quickly. "Robert, is that really necessary? We're all here for the well-being of your daughters." "That's precisely why, Eliza." His tone was calm but firm. "If you're going to examine my daughters, I need to verify your credentials. Standard procedure. I'm sure you understand." The two men looked uncomfortable. Dr. Marshall fumbled in his pocket, producing a professional card which he handed to Robert. The document looked legitimate, but something in the man's demeanor aroused suspicion. "Doctor, would you mind if I called the state medical board to confirm?" Robert asked, pulling out his phone. "This is an insult," Eliza protested, standing up. "I brought 2 respected colleagues to help, and you treat them like imposters." "I said nothing about imposters, Eliza." Robert faced her directly. "I just want to verify credentials before allowing them to examine my daughters. Any father would do the same." Dr. Peters exchanged a look with Eliza and stood up abruptly. "Perhaps we should reschedule this consultation for a more appropriate time," he suggested, picking up his briefcase. "When Mr. Ashford is more receptive." "I agree," said Dr. Marshall, also rising. "Dr. Monroe, may we have a word in private?" The 3 headed for the door, conversing in low, tense voices. Robert remained in the room, his heart pounding in his chest. When the front door closed, Mrs. Celia approached him. "I called the number on Dr. Marshall's card," she reported in a low voice. "The office exists, but the answering machine says the doctor has been at a conference in Europe for the past 2 weeks. Robert felt a chill run down his spine. "Who are those men, then?" The housekeeper shook her head gravely. "I don't know, sir, but I am sure of one thing. This situation is even more serious than we imagined." That afternoon, while the twins slept peacefully under Jane's care, Robert made a call he should have made months ago, to an old college friend who had become a pediatric neurologist in Boston. "Richard, it's Robert. I need your help, and absolute discretion." The morning had barely begun when the Ashford house was invaded by the sound of sirens and authoritative knocking on the front door. Robert, who had finally fallen asleep after nights of vigil, woke with a start. In the hallway, he found Mrs. Celia already on her way to the entrance, her usually impassive face now marked with concern. "What's going on?" he asked, still disoriented from the abrupt awakening. Before the housekeeper could answer, the door was opened, revealing 2 uniformed police officers and a man in a suit who immediately identified himself. "Detective Michael Carter, Child Protective Services Division. We have a warrant to inspect the residence and verify the situation of the minors, Clara and Sophia Ashford." Robert paled, taking the extended document with trembling hands. "I don't understand. Why? What happened?" "We've received serious allegations," the detective explained, as the officers already entered, surveying the area. "Suspicion of medical negligence, improper administration of medication, interference with prescribed treatment." "Allegations? From whom?" "The source is confidential, Mr. Ashford. We need to check the children's room and speak with all employees of the residence." At that moment, Jane appeared at the top of the stairs, holding Sophia in her arms, while Clara slept peacefully in the room. "What's happening?" she asked, her voice low so as not to disturb the baby. The detective examined her with renewed interest. "And you would be—" "Jane Miller. I work as a domestic employee here. The one who has been interfering with the children's medical treatments." The tone was accusatory. Robert intervened quickly. "She only helps with the girls, following my instructions. I am their father and legal guardian." One of the officers went up the stairs, heading to the twins' room. Jane shot an alarmed look at Robert, who nodded discreetly, indicating that she should cooperate. "We need to check the medications," the detective continued. "We received specific information about unauthorized substances." "All medications were prescribed by the girl's pediatrician," Robert replied, trying to remain calm as he followed the detective upstairs. "Although we Recently reduced the doses on the recommendation of another specialist. The officer already in the room was rummaging through the medicine cabinet, photographing the vials. Suddenly, he held up a small container without a commercial label. "What is this?" "I don't know," Robert answered truthfully. "I've never seen that vial before." The officer opened the dresser drawer and pulled out 3 more similar vials, hidden under diapers. "And these? You don't recognize them either?" A chill ran down Robert's spine. "I'm absolutely certain I've never seen those vials. They weren't here last night when I bathed the girls." The detective exchanged significant looks with the officer. "We'll need to confiscate these items for analysis," he said, placing the vials in a plastic bag, "and question all employees." For the next 2 hours, the mansion became an investigation scene. Mrs. Celia was questioned in detail about the children's routine and visitors to the house. The gardener, the driver, everyone had to give statements. But it was with Jane that the interrogation became most intense. "Miss Miller," the detective began in the small study where he conducted the interviews, "we have information that you administer unprescribed substances to the children." "That is completely false," Jane replied, maintaining her composure despite her growing fear. "I have never given any medication to the girls without Mr. Ashford's express permission and always following a doctor's prescription." "And what about special teas? Calming mixtures?" The detective consulted a folder with notes. "I have never prepared anything like that. Whoever said such a thing is deliberately lying." "We also have information about your psychiatric history." Jane felt her blood run cold. "I have no psychiatric history." "Our records indicate that you suffered a pregnancy loss 6 months ago and were diagnosed with postpartum depression and obsessive behavior regarding other children, is that correct?" "I lost my son, yes," Jane replied, her voice trembling slightly. "But I never received such diagnoses. Who provided this false information?" The detective ignored the question. "You have access to the children's rooms, food and medications. You are in an ideal position to interfere with their treatment." "Detective," interrupted Robert, who had insisted on attending all the interrogations, "Jane has been fundamental to my daughter's well-being. Any accusation against her is baseless and malicious." "I understand your position, Mr. Ashford, but we have concerning evidence." The officer inspecting the service area entered, the room carrying a box. "Detective, we found this in Miss Miller's personal locker." Inside the box were more vials, similar to those found in the twins' room, along with receipts from a compounding pharmacy and handwritten notes on dosages. Jane's eyes widened in genuine shock. "That's not mine. I've never seen those items. Someone planted them there to frame me." "That's a serious accusation, miss," the detective replied, examining the items. "Are you suggesting someone forged evidence against you?" "That's exactly it. Please check the vials, the fingerprints. You won't find mine." "We will run all the necessary tests," the detective assured her, his tone softening slightly at the young woman's evident distress. "For now, I'll need you to accompany the officers to the station to give a formal statement." "Is she being arrested?" Robert asked, alarmed. "Not officially, sir. Just questioned in a proper setting. You may accompany her if you wish or arrange for legal assistance." "I'll go with her, of course," Robert decided immediately. "And I'm calling my lawyer now." The detective hesitated. "Mr. Ashford, given the nature of the accusations, we need to ensure the children's safety. A social worker will be arriving shortly for an evaluation." "My daughters will not be removed from their home," Robert stated firmly. "I am perfectly capable of caring for them, and I have Mrs. Celia for support." "That will be determined by the technical team," the detective replied. "For now, I recommend that you remain with the girls. We can question Miss Miller without your presence." Robert found himself in an impossible dilemma: accompany Jane, who was clearly being framed, or stay to protect his daughters from a possible removal. "Stay with the girls," Jane said softly. "They need you more right now. I'll be fine." Their eyes met, a silent communication of trust and concern. In that moment, something shifted between them, the recognition that they were facing something bigger than they had imagined, together. At the station, Jane's interrogation lasted for hours. The questions were repetitive, exhausting, clearly designed to confuse her or provoke contradictions. Without a lawyer present, the one Robert had called was still on his way, she held firm to her story. She had never administered any substance to the children, she did not own the vials that were found, and someone was deliberately trying to frame her. "Who would have a motive to do that?" asked the deputy detective, a middle-aged woman with an inquisitive gaze. "Dr. Eliza Monroe," Jane answered without hesitation. "The twins' pediatrician." "And why would she do that?" Jane took a deep breath before answering. "Because we discovered she has been administering harmful substances to the children to keep them dependent on her care. She has an obsession with Mr. Ashford and uses the girls to remain indispensable." The detective raised her eyebrows, clearly skeptical. "That's an extremely serious accusation against a respected professional. Mrs. Celia has detailed records. There are clear patterns. The girls' crises always worsen after Dr. Monroe's medication. When we stopped it, they improved significantly. So you admit that you interfered with the prescribed treatment?" "I did not interfere. The father himself decided to temporarily suspend the medication for observation, as is his right." The interrogation room door opened, interrupting the conversation. An officer entered and handed a document to the detective, who read it with a grave expression. "Miss Miller, we have the preliminary analysis results for the vials found in your locker. They are controlled substances, including neurological stimulants in a concentration far above what is permitted for pediatric use." Jane felt the floor drop, out from under her. "That's impossible. I've never had access to such substances. Please check the fingerprints." "We already have. There are partial prints of yours on 2 of the vials." "No, there must be a mistake, or—" A terrible realization hit her. "Or someone used objects I've touched to transfer my prints. That's possible, isn't it? Technically possible." The detective didn't answer directly, but continued. "Based on this evidence and the severity of the accusations, I am formalizing your preventive detention on suspicion of child endangerment, improper administration of controlled substances, and putting minors at risk." "No, please. The girls need protection from the real culprit." Her protests were cut short by the sound of the door opening again. This time it was the lawyer sent by Robert, arriving too late to prevent the arrest, but in time to ensure the procedures were followed correctly. "I will appeal immediately," he assured Jane as she was led away for processing. "This is clearly a frame-up." At the mansion, Robert was facing his own nightmare. The social worker, a woman named Teresa, was interviewing Mrs. Celia while he tried to calm the twins, who were agitated by all the commotion. His phone rang. It was his friend Richard, the pediatric neurologist. "Robert, I've managed to analyze the medication samples you sent me," he said without preamble. "I'm shocked. They're mainly neurological stimulants, in increasing doses. It would perfectly explain the symptoms you described. Agitation, insomnia, hypersensitivity." My God, Robert felt dizzy. Eliza was drugging my daughters. Unfortunately, it seemed so, and the worst part, the doses were systematically increased, creating physical dependence. Abruptly stopping could cause withdrawal symptoms, which she would likely use as proof that the medication was necessary. "We need these analyses officially. Jane has been arrested, Richard. They're accusing her of being responsible. I'm documenting everything and can testify officially. I've also contacted colleagues on the Medical Ethics Board. This is extremely serious, Robert." The call was interrupted by the arrival of Dr. Monroe, who entered the room accompanied by the social worker. "Robert, how awful," she exclaimed, her expression of concern perfectly composed. "I came as soon as I heard. How are the girls?" He felt an icy rage crystallize in his chest. "What did you do, Eliza?" She blinked, confused or feigning confusion. "What are you talking about?" "I came to help, of course." The social worker informed me of the terrible situation. That employee, I always suspected there was something wrong with her. The social worker watched the interaction attentively. "Dr. Monroe has kindly offered to perform a full examination of the children," she explained, given her familiarity with the case. "No," Robert said firmly. Eliza is not touching my daughters again." "Robert!" She looked genuinely shocked. "How can you say that after everything I've done for you?" "I know exactly what you've done." He stepped back, shielding the twins with his body. "And it's over. I have the analyses of the substances you were giving my daughters. I know about the stimulants, the increasing doses." Eliza's face transformed subtly, an almost imperceptible change, but one that revealed something cold and calculating behind the mask of concern. "I don't know what you're talking about. Clearly that employee has poisoned your mind as well as the children." "Mr. Ashford," the social worker intervened, "these are very serious accusations. Do you have any proof of what you're saying?" "I have lab analyses, detailed records from Mrs. Celia, the testimony of another specialist, and the most convincing fact of all, my daughters are visibly better since we stopped Dr. Monroe's medication." Mrs. Celia approached silently, carrying her brown notebooks. "I have here," she said calmly, "daily records from the last 6 months. Precise medication times, reactions, visits, everything, including occasions when Dr. Monroe came unannounced, when no one was home." Eliza paled visibly. "This is absurd. You're just a senile maid making up stories." "And what about the vials planted in Jane's locker?" Robert continued. "How convenient that they appeared just when we started questioning your treatment." The social worker, realizing the gravity of the situation, intervened. "I believe we need to clarify these matters formally. Dr. Monroe, given these allegations, it would be appropriate for you to temporarily step away from the case." "This is ridiculous. I've been these children's doctor since they were born. Robert is being manipulated by an unstable employee who lost her own child and is now projecting her fantasies onto the twins." "That unstable employee," Robert replied calmly, "was the only one who truly helped my daughters, and now she's in jail because of you." The social worker made notes on her clipboard, her expression professional but clearly concerned. "Mr. Ashford, considering the circumstances, I see no need for the children's removal at this time. However, I strongly recommend an independent evaluation by specialists designated by Child Services." "I completely agree," he replied, relieved by this small victory. Eliza, realizing she was losing control of the situation, tried one last approach. "Robert, think of the girls. They need consistent care. I've worked with your family for years. I knew Beatrice. She trusted me." Upon hearing his late wife's name on Eliza's lips, something definitively broke in Robert. "Get out of my house, Eliza, now, and don't come back." For a moment, Eliza's professional mask fell completely, revealing an icy fury that confirmed all their suspicions. Then, quickly composing herself, she picked up her bag. "You will regret this," she said quietly for his ears only, "when the girls get worse again, and they will. Remember that I tried to help." When the door closed behind her, Robert felt as if a huge weight had been partially lifted from his shoulders. But the battle was just beginning. He still had to prove Jane's innocence and Eliza's guilt, as well as ensure the proper treatment for his daughters. What he didn't know was that Eliza, inside her car parked outside the property, was already typing furiously on her phone, contacting connections at hospitals, medical boards, and the press. The war she had started was far from over. The days that followed were a whirlwind for everyone involved. Jane remained in custody as her case made local headlines. Domestic worker accused of administering illegal medication to children. Her image, captured as she was escorted to the police station, was shown repeatedly on the news, accompanied by sensationalist headlines. In the Oak Ridge Women's Correctional Facility, she faced isolation and premature judgment. Other inmates, upon learning of the accusation involving children, treated her with hostility. The guards, influenced by the media coverage, barely disguised their contempt. Her mother, located by reporters in Springfield, gave a devastating interview. "I don't recognize my daughter anymore. Ever since she lost the baby, she hasn't been the same." Meanwhile, Robert was fighting his own battle. With the support of his pediatric neurologist friend Richard Cole, he arranged for the twins to be evaluated by an independent multidisciplinary team. The preliminary diagnosis confirmed his suspicions: Clara and Sophia showed characteristics consistent with autism spectrum disorder at a moderate level. Their sensory hypersensitivity, difficulty with eye contact, and intense reactions to change were not phases. As Eliza had insisted, they were part of who they were. "They are not sick," explained Dr. Paula Mason, the new team's pediatric neurologist. "They are neurodivergent. They perceive and process the world differently. With the right support, they will reach their full potential." The lab analyses of the medications administered by Eliza revealed a disturbing scheme: increasing doses of neurological stimulants mixed with mild sedatives, a combination that caused agitation followed by exhaustion, keeping the children in predictable cycles of crisis. "This is criminal medical manipulation," stated Dr. Richard indignantly during a meeting with Robert's lawyer. "She deliberately created a condition of chemical dependency in the children. When you and Jane interrupted the cycle, Eliza needed to re-establish it urgently, or she would be discovered." Armed with this evidence, Robert's lawyer filed a formal complaint against Eliza with the State Medical Board and a criminal complaint in court. Simultaneously, he fought for Jane's release, arguing that all the evidence against her had been fabricated. "We need to act fast," Robert insisted. "Every day Jane spends unjustly imprisoned is torture for her." Mrs. Celia, who had remained a pillar of stability at the mansion, cared for the twins with dedication, implementing the recommendations of the new medical team: environments with soft lighting, predictable routines, deep pressure techniques she had learned from watching Jane, all to create a safe space for Clara and Sophia. "They ask for her," the housekeeper commented one evening as she served tea to Robert in the library. In their own way, of course. Sophia looks at the door when she hears footsteps, as if expecting Jane to walk in. Clara holds onto that little cloth Jane used to soothe her. Robert rubbed his tired eyes. "I miss her so much," he admitted, his voice thick with emotion. "Not just for what she did for the girls, but for her strength, her kindness." Mrs. Celia nodded, understanding. "The heart chooses its own paths, sir, even in the midst of a storm." The next morning, the case took an unexpected turn. A nurse from the hospital where Eliza worked contacted Robert's lawyer with crucial information. It wasn't the first time the doctor had become obsessed with a male patient. 3 years prior, a widower with a young daughter had requested a transfer to another professional after similar behaviors. She would create medical emergencies, the nurse revealed. Situations where only she could solve them. She made herself indispensable, created dependency. When the father started to question her, she accused him of negligence. He almost lost custody of his daughter. This witness paved the way for others. A pharmacy technician confirmed that Eliza frequently requested non-standard compounded medications with unusual combinations. A hospital secretary revealed duplicate files the doctor kept, official versions, and her personal notes with conflicting dosages. The net was closing in. When police went to Eliza's house with a search warrant, they found a veritable archive on the Ashford family. Photos of Robert, taken without his knowledge, detailed information about Beatrice, meticulous records of the twins since birth, and most disturbingly, a detailed plan to permanently integrate into the family after the removal of the disruptive element, clearly referring to Jane. With this evidence, the judge finally ordered Jane's immediate release after nearly 3 weeks of unjust detention. Robert was at the prison gate when she walked out, looking worn, but with her head held high. "You came," she whispered, tears in her eyes. "Of course I came." He held her hands gently. "I never doubted you, not for a second." The drive back to the mansion was silent, heavy, with restrained emotions and unspoken words. When they finally arrived, Mrs. Celia was waiting at the entrance with a discreet smile. "The girls just woke up from their nap," she informed them. "I think they'd like to see someone." Jane hesitated at the door of the twins' room, suddenly insecure. Weeks in prison had left their mark, not just physical, but emotional. She felt fragile, exposed. "It's going to be okay," Robert assured her gently. "They've missed you." In her crib, Clara was the first to notice Jane's presence. To the surprise and emotion of everyone, the baby stretched her little arms out towards her, a rare and precious gesture of recognition. "Hello, little one," Jane whispered, picking her up carefully. "I missed you so much." Sophia, in the crib next to her, rocked excitedly, her unique way of showing joy. "They're different," Jane observed, noticing small changes, more responsive. "The sensory therapy has helped a lot," Robert explained. "And the absence of those substances, of course. They're finally just being themselves, without chemical interference." That night, after the girls had fallen asleep, Robert and Jane sat on the porch, the starry Berkshire sky above them, a shared blanket against the mountain chill. It was time for necessary conversations. "Eliza will be tried," Robert informed her, "both criminally and by the medical board. The evidence is irrefutable." "How is she?" The question surprised Robert, Jane's genuine concern for someone who had tried to destroy her. "She's been committed to a psychiatric clinic by court order. Preliminary reports indicate severe obsessive-compulsive disorder with fixation and manipulative behavior." Jane nodded silently. After a moment she asked, "And the girls? Was the diagnosis confirmed?" "Yes. Autism spectrum, just as you suspected from the beginning." He smiled sadly. "If I had listened to you sooner—" "Don't blame yourself," she interrupted softly. "You trusted her. She had been the family doctor for years, and she used that trust against all of you." They sat in silence for a few moments, watching the city lights in the distance. "Your mother called today," Robert finally commented. "She's sorry for the statement she gave to the press, said she was pressured, that she was confused." Jane felt tears welling up. "I don't know if I'm ready for that reunion," she admitted. "Those were very harsh words. You have time to decide. All the time in the world is yours now." She looked at him, studying his face in the soft light of the terrace. She saw the exhaustion, yes, but also something new, a determination, a nascent peace. "What happens now?" she asked, giving voice to the question that hung between them. "Now, we rebuild. The girls need stability, proper therapies, understanding. I need to learn to be the father they need." "You'll be amazing," she assured him. "You already are." Robert covered her hand with his, a simple touch, but one laden with meaning. "And you, Jane? What do you want for your future?" She took a deep breath, realizing it. It was the first time in a long while that anyone had asked about her own desires. "I want to build something new, something good out of so much pain. Maybe help other families with neurodivergent children." "You could start here," he suggested cautiously. "Not as an employee, of course, but as a consultant, a partner." The word hung between them, full of possibilities. "I would like that very much," she finally replied, a small smile forming on her lips. 6 months passed. The Ashford mansion, once shrouded in tension and despair, gradually transformed. The walls were repainted in soft colors, the rooms rearranged to accommodate the twins' sensory needs. An entire room was dedicated to therapy, with swings, a ball pit, controlled lighting. Clara and Sophia, now nearly 2, were developing at their own pace. Clara was already forming a few words, though she preferred to communicate through a system of picture cards developed by Jane. Sophia, more sensitive to sounds, found joy in classical music and the repetitive patterns of nursery rhymes. Jane, who had initially continued to live in her small room at the back, gradually occupied a different space in the house and in the family. Her relationship with Robert evolved with the same caution and respect with which they treated the girls, without rush, with attention to signals, respecting boundaries and celebrating small victories. Mrs. Celia observed it all with silent approval, still recording events in her notebooks, now not as evidence but as memories to be preserved. Jane's reunion with her mother, Margaret, was difficult at first. Deep wounds don't heal overnight, but slowly, visit by visit, the relationship was rebuilt. Margaret learned about neurodivergence, about grief, about new beginnings, and Jane learned about forgiveness. On a sunny spring afternoon, the whole family, because that's what they had become, gathered in the garden for a small moment of celebration. The twins were turning 2, and although they didn't understand the meaning of the date, they felt the joy in the air. "Look," Robert called, pointing to Sophia, who, for the first time, was trying to imitate the motion of blowing out the candles that Jane was demonstrating. Clara, on the other hand, wasn't interested in the cake, but was fascinated by the soap bubbles Mrs. Celia was blowing into the air. Her eyes followed the iridescent movements with a rare and precious concentration. "Small victories," Jane murmured beside Robert. "Small, daily miracles." He nodded, discreetly holding her hand. "Thank you," he said simply, "for saving us." She smiled, squeezing his fingers back. "We saved each other." That night, after the girls had fallen asleep, Jane found a small, bound book on her bed. Opening it, she recognized Mrs. Celia's meticulous handwriting. It was a compilation of her records from the past few months, no longer crises and medications, but achievements. Clara smiled upon hearing the music. Sophia accepted a new food texture. They both slept through the night. On the last page, a single sentence: "Family is not just about blood." Outside, the hills were shrouded in their traditional nightly mist, but inside the Ashford mansion, clarity finally prevailed. The wounds would continue to heal. The twins would continue to challenge and surprise. The adults would continue to learn, adapt, grow. And in the small psychiatric clinic miles away, Eliza Munro watched through a barred window, consumed by her own demons. While the family she had tried to manipulate finally found their own way, one paved not by control or obsession, but by understanding, respect, and a love that chose to blossom in the most unlikely of places. In that mansion in the hills, the silence of the children's rooms was no longer oppressive but peaceful. The twins slept soundly, not due to the effect of substances, but because they were finally understood, accepted, and loved exactly as they were. And when the occasional cry still echoed through the old walls, it was no longer met with despair, but with the certainty that together they would find their way through the storm. Always together, always moving forward. A family built not by the chance of blood, but by the deliberate choice to stay, to care, to love. End of story. Dear listeners, we hope the story of Robert, Jane, and little Clara and Sophia has touched your hearts. This journey shows us how, even in the most difficult situations, we can find the strength to start over and people who light our way when everything seems dark. To continue experiencing emotions like this, we have a special playlist with other stories that explore the complexity of family relationships and the beauty of new beginnings. Find it by clicking here on the side. If this narrative sparked something in you, don't forget to subscribe to the channel and leave a like. Your comments are valuable to us. Tell us how you felt if you've ever been in situations where you had to fight for the truth, or if you know stories of families formed by the heart, not just by blood. We'll be back tomorrow with another moving story that will make you reflect, feel, and perhaps see the world through different eyes. Until then,